Nursing interventions for anti-diabetic agents. There are different types of anti-diabetic agents. There's rapid-acting, intermediate-acting, combination, short-acting, and long-acting for insulin. You want to monitor the lab. Glucose should be between 60 and 100. The A1C should be less than 6.5. With an insulin reaction, which is hypoglycemic, and it could result in tachycardia.
Pregnancy Category C drugs include Lantus, Novolog, and Apidra, whereas Pregnancy Category B drugs include Humulin N, Novolin N, Levemir, Humulin 70/30, Humulin NPH 50/50, and Humalog 75/25.
Illness, infection, stress, hospitalization, and surgery are all things that can affect your blood sugar. Your dose of insulin will be individualized. Signs and symptoms of hypoglycemic reaction related to insulin: blood sugar lower than 60, increased sweating, increased heart rate, nervousness, tremors, headache, lightheadedness, apprehension, cold, clammy, slurred speech, confusion, seizures, and memory lapse. Hypoglycemic often occurs during peak action times, may have severe reaction without knowing it. Take sugared candy or drinks such as orange juice at start of reaction. Teach family how and when to administer glucagon. Signs and symptoms of hyperglycemic reactions: diabetic acidosis, blood sugar level 250 or higher, increased thirst, urinary output increase, sweet fruity breath, rapid thready pulse, poor skin turgor, dry mucous membranes, and small breathing. Drug-herb interactions will show hyperglycemic effects and hypoglycemic effects.
Other drug-to-drug interactions that increase a hypoglycemic reaction is aspirin, oral anticoagulant, alcohol, oral hypoglycemic, beta blockers, MAOIs, tetracycline, and TCAs, which are tricyclic antidepressants. Other drug-to-drug interactions that decrease the hypoglycemic reaction are thiazide, glucocorticoids, oral contraceptives, thyroid drugs, and smoking. Always let the patient know to carry or wear their medical alert identification, which is either a bracelet, card, or a tag. For insulins, you want to be careful to never freeze them. You want to avoid all high temp, avoid direct sunlight, refrigerate unopened until needed. Other storage, so we have, if you open a vial, it's good for 1 month at room temperature, but if you refrigerate it, it's good for 3 months. It does lose strength after approximately 3 months, so you'd want to discard that. There's pre-filled syringes that you want to store in fridge, and you want to use within 1 to 2 weeks of purchase of the pen. More patient education is upon medication administration. You want to let them know that it decreases tissue irritation if injected at room temperature.
Definitely instruct your patients to have an 8-day rotation schedule and to keep a record of the sites and date. They need to rotate the sites to prevent interference with insulin absorption via lipodystrophy. Lipodystrophy can result in lipoatrophy or lipohypertrophy. Lipoatrophy will result in tissue atrophy, which is depression under the skin's surface. It's prominent in women and children. Lipohypertrophy is tissue hypertrophy, which is a raised lump on skin surface. Is prominent in men. Definitely instruct your patients to administer this subcutaneously on the upper arms, thighs, lower abdomen, and lower back. Overall, definitely use caution if there has been a health status change, including fever, infection, nausea, vomiting, surgery, trauma, or hyperkalemia.